Tobago's first shot of the Oxford Astra-Zeneca COVID-19 vaccine went to Dr. Ogona Okeke, head of internal medicine at the Scarborough General Hospital. He was among the 100 healthcare workers immunized in the first phase of the island's COVID-19 vaccination rollout. Dr. Anthony Thompson, a house officer at the hospital, was among them as well, and he was confident in getting the vaccine.
I believe it will work for me, but the more important thing is that it's going to work for us as a community, in the sense that once we can lower the risk of people developing severe forms of the illness, then it allows us to have higher levels of activity, right? And we don't have to live in fear that if there's a surge, we all have to run back and shelter in place, because we know that we protected the population. So this isn't something that I'm doing for me. This is something that we are doing for us.
The Barbados government donated 2,000 doses of the Oxford AstraZeneca vaccine to Trinidad and Tobago. Those in the front line of health care received the 2-dose vaccination first. Secretary of Health, Wellness and Family Development, Tracy Davidson-Celestine, explains why the doses have been given to health workers.
We are now at the point where we have received a first batch of vaccines, which will go a long way in ensuring that those who are the frontline staff are not in any way significantly exposed to anyone who would come forth being COVID positive, as the case might be. So the point is, we have been making strides, progressive steps towards treating and eliminating COVID-19 on the island once and for all.
Once the TRHE acquires subsequent doses of the COVID-19 vaccine, recipients will be selected on a priority basis. They include people with non-communicable diseases, those over 60 years, workers in the essential services, then the general public. An appointment-based system will be used as the vaccination plan is implemented. This ensures that people can be carefully monitored. Acting General Manager for Primary Care Services, Dr. Roxanne Mitchell, says the introduction of the COVID-19 vaccine brings some key benefits.
It will allow us to travel and to get a sense of normalcy, something close to what was, but it wouldn't be, but something close to what was. So that the vaccine affords us that opportunity for economic stability and for better intersocial and global interactions.
It's in the early stages of vaccinations, so the public is being asked to continue following health protocols. These include wearing a mask, thorough hand washing, using alcohol-based hand sanitizers, and practice physical distancing. The aim is to eventually achieve herd immunity, getting 75 to 80% of the population vaccinated. I'm Omodara Mills for Let's Talk Tobago.